Dengue fever. Imagine waking up with a sudden high fever, severe body aches, and a headache so intense you can barely get out of bed. You might think it's the flu, but in some cases, it could be dengue fever, a mosquito-borne viral infection that can become dangerous surprisingly quickly. And here's what makes dengue especially tricky. Some of the most serious warning signs can appear just as the fever starts to improve. In this video, you'll learn the symptoms of dengue, the warning signs of severe dengue, how doctors diagnose it, what treatment actually involves, and how you can protect yourself. What is dengue? Dengue is a viral infection primarily transmitted through the bite of infected Aedes mosquitoes. These mosquitoes can bite during the daytime, and they can spread dengue from an infected person to another person. Dengue is especially common in many tropical and subtropical regions around the world. For people in the United States, the risk can be particularly relevant when traveling to areas where dengue is common, and some local transmission can also occur in parts of the country where Aedes mosquitoes are established. Dengue equals mosquito-borne viral infection. How does dengue start? After an infected mosquito bites you, symptoms may not appear immediately. When symptoms do develop, dengue commonly causes a sudden fever along with headache, pain behind the eyes, muscle and joint pain, nausea, vomiting, and sometimes a rash. The illness often develops in phases. And that's important, because the period when the fever goes away is not always the point when the danger is over. Warning sign number 1. Severe abdominal pain. Warning sign number 1. Severe abdominal pain or tenderness. Mild stomach discomfort can happen with many infections, but intense or persistent abdominal pain during dengue should not be ignored. It can be a warning sign of severe dengue and requires prompt medical evaluation. Warning sign number 2. Persistent vomiting. Warning sign number 2. Persistent vomiting. Repeated vomiting can cause dehydration, make it difficult to keep fluids down, and may occur alongside worsening dengue. If someone with suspected dengue cannot keep fluids down, especially when other warning signs are present, medical attention is important. Warning sign number 3. Bleeding. Warning sign number 3. Unusual bleeding. This can include bleeding from the nose or gums, blood and vomit or stool, or unusual vaginal bleeding. Dengue can affect the body's ability to maintain normal blood clotting and can cause dangerous complications. Any significant or unusual bleeding during suspected dengue needs urgent medical attention. Warning sign number 4. Extreme weakness or restlessness. Warning sign number 4. Extreme weakness, unusual restlessness, or changes in alertness. A person with dengue may become extremely tired, but if weakness becomes severe, or the person becomes unusually restless, confused, drowsy, or difficult to wake, this can signal a serious complication. That is not something to simply watch at home. Warning sign number 5. Rapid breathing or breathing difficulty. Warning sign number 5. Rapid breathing or difficulty breathing. Severe dengue can cause fluid leakage and other complications that may affect circulation and breathing. If someone with suspected dengue develops trouble breathing, chest discomfort, severe weakness, or signs of shock, seek emergency medical care immediately. Warning sign number 6. Cold, pale, clammy skin. Warning sign number 6. Cold, pale, or clammy skin. These can be signs that the body is having trouble maintaining adequate circulation. In severe dengue, shock can develop rapidly. If a person becomes cold, pale, clammy, very weak, dizzy, or difficult to wake, don't wait for the symptoms to disappear. Warning sign number 7. Symptoms getting worse after fever improves? And here is one of the most important things to remember. A person can develop warning signs around the time the fever begins to go away. So don't assume that a lower temperature automatically means the danger has passed. If severe abdominal pain, persistent vomiting, bleeding, breathing problems, extreme weakness, or other warning signs appear during this period, seek medical care immediately. Warning signs 8. Common dengue symptoms. So what does typical dengue look like? Common symptoms can include sudden fever, severe headache, pain behind the eyes, muscle, bone, or joint pain, nausea or vomiting, and a skin rash. Symptoms can range from mild to severe, and not everyone will experience all of them. Common symptoms: fever, severe headache, pain behind the eyes, muscle and joint pain, nausea, vomiting, rash. How do doctors diagnose dengue? Dengue cannot be reliably diagnosed based on symptoms alone. Doctors consider your symptoms, travel history, mosquito exposure, and the areas where you have recently been. Blood tests can help confirm a dengue infection. If you've recently traveled to an area where dengue is common and then develop a high fever or other symptoms, tell your healthcare provider where you traveled and when. Treatment. What actually helps? There is currently no specific antiviral medicine that cures dengue. Treatment is mainly supportive. That means rest, maintaining adequate fluid intake, and medical monitoring when needed. For fever and pain, acetaminophen, also known as paracetamol, is generally recommended. But there is an important medication warning. Medication warning? People with suspected dengue should generally avoid aspirin and nonsteroidal anti-inflammatory drugs, such as ibuprofen, unless a healthcare professional specifically tells them otherwise. These medications can increase the risk of bleeding. If you think you may have dengue, talk to a healthcare professional about which medication is appropriate for you. How to prevent dengue? Now let's talk prevention. The best protection against dengue is preventing mosquito bites. Use an EPA-registered insect repellent according to the label. Wear long sleeves and long pants when practical. Use screens or air conditioning when available. And remove standing water around your home, because mosquitoes can breed in surprisingly small containers of water. Mosquito Prevent Mosquito Bites USA Travel Warning? If you're traveling outside the United States, especially to tropical or subtropical regions where dengue is common, take mosquito protection seriously. And remember, getting bitten once may be enough. So don't wait until you arrive at your destination to think about prevention. United States TRAVELING? Protect yourself. When to seek emergency care? Here's the bottom line. If you have suspected or confirmed dengue and develop severe abdominal pain, persistent vomiting, unusual bleeding, difficulty breathing, extreme weakness, confusion, cold or clammy skin, or other signs of serious illness, seek emergency medical care immediately. Severe dengue can become life-threatening. Early medical evaluation can make a critical difference. Revolving light: don't wait for it to get worse. Let's quickly recap. Watch for severe abdominal pain, persistent vomiting, unusual bleeding, extreme weakness or changes in alertness, rapid or difficult breathing, cold, pale, or clammy skin, and symptoms that become worse around the time the fever improves. Knowing these warning signs could help you recognize when dengue needs urgent medical attention. If you found this information useful, subscribe for more evidence-based health videos designed to help you understand serious medical conditions before they become emergencies. And share this video with someone who travels frequently to tropical or subtropical regions.